Welcome to BNEWS Community Update. I'm Phil Gallagher, along with my guest today, Susan Lumenello, who's Director of Public Health for the Board of Health, and Sandra Troiani, who is the head nurse. Would that be the proper introduction?
Public health nurse.
Public health nurse. Okay, great. And our topic today is the Board of Health, what they do, and also the flu season. So we'll start with Susan. You're in your 15th year.
Yes, I started with the Board of Health in 2010 as the environmental engineer, and I served as the environmental engineer for 2 years, and then in 2012 I became the Director of Public Health.
What exactly is your role at the Board of Health?
I oversee all functions of the department. I do the budgeting, I apply for the grants, I manage the grants. Right now we have a large grant from the Mass Department of Public Health with Lexington and Wilmington, and Burlington is the lead agency, so we have 5 part-time positions under that grant, as well as the Board of Health staff. So we have a associate director, the public health nurse, 2 health inspectors, 2 admins in the Board of Health, as well as the environmental engineer and myself.
Big crew.
Yes.
Okay. And Sandra, what do you do there? What is the general responsibilities?
So I am the public health nurse for the town of Burlington, and my role in there is to teach programs to the public, and also I do case management for reportable diseases. That's
it. Big enough role, huh?
Yes.
Keep you busy.
Mm-hmm.
Okay, well, let's talk about the other, particularly the health inspections for the town in the restaurant area.
Mm-hmm.
I mean, this has had explosive growth since you've joined, right? In the last 15 years?
Since I've joined, we've actually added the position. We've always had the health agent position, and several years ago we added the associate health inspector position because we needed a second position to keep up with all of the number of inspections that we do. It's not only just restaurants, it's public and semi-public pools, tanning, keeping of animals. There's a lot of inspections that we need to do under the local and the state regulations. So in order to accomplish all those inspections, we did need a second inspector, and that's been working out very well. And now with the grant, we also have a health inspector on the grant who does tobacco inspections, both retail and compliance check inspections, as well as health inspections.
And how has compliance been going? Particularly, I know you've had some spot inspections over the years for cigarette sales to minors and things of that sort.
Yeah, so that's what our inspector in the grant is currently working. We also have a grant from Mass Department of Public Health for that, specifically for doing tobacco retail and compliance checks. So it's been going okay. The regulations are pretty strict. I mean, you need to, if you sell to a minor, it's an immediate $1,000 fine. So, and then if you do it again within the next 36 months, it's $2,000 and suspension of your permit, and then the fines just go up from there. So luckily we haven't had that in some time, but it does happen. So, and we issue fines, and
well,
if we
it might
have
not
to,
be
second
happening
and third
because
ones.
we're pretty stringent about it. That could be
We are strict.
prevention.
Yeah.
Yeah. Now, what about on the development side? A lot of the development proposals come through the Board of Health. What role does the Board of Health have to play in that?
So that's mainly our environmental engineer reviews those plans, sometimes the health agent if it's a restaurant or if there's a grease interceptor involved. We make comments to the planning board on all the plans that come through. So we are involved with, of course, the subdivision plan, but all the other plans we make comments on. So we're looking at drainage, we're looking at past environmental issues. One of the things that our board has been very diligent about is if a new development is in an area where there was past contamination, especially volatile organics in the groundwater, one of the conditions that we put on developers is to put a vapor barrier into into the new building to ensure that those vapors cannot go back into the building.
Right.
So that's something that we've done quite a few times over the years.
So you're kind of integrated with 21E. What is 21E?
So 21E is the old name for the environmental regulations when they came out like in the 80s. So now that has changed into what's called the Massachusetts Contingency Plan, or the MCP. So we don't enforce the MCP, the Mass Department of Environmental Protection enforces that, but we are familiar with it. We know what stage each one of our sites are in regarding the cleanup process.
Mm-hmm. So you have a pretty experienced board, don't you?
Yes, we do, yeah.
Ed, I think, has been 38 years?
Yes, and he is very involved in environmental contamination and the site reviews. And
but that's slowed down quite a bit since the 80s, since the south side contamination, since the well contamination, since the north side contamination when we put up the new, well, what is now the old water treatment plant.
So those sites are still, some of those older sites are still open in that they have to continue monitoring and making sure, or continue treatment, groundwater treatment if they need to. So they're still open, and we're still like looking at them and monitoring them. There isn't a whole lot of like new spill sites. Usually if it's something like that, it might be a transformer or an oil spill or something. Right. No large sites like they used to be, but those sites, older sites, are still being monitored by us. And now Mass DEP is going back and looking at these older sites and making them test for PFAS. Right. So PFAS is an emerging contaminant, and they now need to test for that as well. So some of these older sites get opened up again because of the PFAS requirements. Well,
you bring that up, but we just spent $15 million for a, well, not just, but 2 years ago, $15 million on the Mill Pond treatment plant for PFAS. But how much research is done, and how much definitive information has come out about PFAS?
So it's a lot of research has come out in the last several years. Mm-hmm. So I remember, I can't remember the exact date, but a few years ago, right. We were starting to see it emerge, and we had presentations at the Board of Health meeting about PFAS, just to explain to the public. A lot of the public didn't even understand what it was. Right. So since that time, though, a lot of science has been done on how to conduct remediation of PFAS chemicals. Now I go to a yearly conference in the New England area on PFAS. It's a 3-day conference, and it's everything about PFAS, about treatments and about different regulations. So a lot in my time since that time has been, knowledge has been gained on that. Yeah.
It's a forever chemical. Is that what the problem is?
Yes, but you can treat for it.
You can.
Yeah, mm-hmm. Yeah. Now, there's different ways.
The federal regulation was 70 parts per trillion, I think. Was that correct? And then the state dropped it down to 15 parts per trillion. That's why we had to change the filtration system at the water treatment plant?
Yeah, I don't know what they currently are now, or what exactly is going. That water treatment plant is run by DPW, so I'm not sure what exactly their requirements are. The requirements would come from Department of Environmental Protection on that. I think they did just, maybe in the last year or so, look at those numbers again for drinking water, but I'm not sure what they are.
Right.
Yeah.
And this is quite commonly used. I think fire foam is one of the major contributors, isn't it?
There's a lot of contributors. I think that was the thing that people first thought in the beginning, fire foam, right. But it's in a lot of products. And so it ends up in the drinking water because of all the products that it's in. Mm-hmm. So really, I think when you go to the conferences, that another thing that is being talked about is how to get these chemicals out of the products. Mm-hmm. Now, there's so many of them, and we're not testing for all of them. Mm-hmm. So the tests can't even test for all of them. Mm-hmm. So that's why they call it an emerging contaminant, because it's still, a lot of research still needs to be done.
Great. Another chemical that's going to kill us, right? Maybe. Okay, Sandra, what does the nurse do? at the Board of Health? What are some of your roles?
Some of my roles are to vaccinate. We have a program for children that are younger than 18 that don't have health insurance. They could have health insurance, but the health insurance doesn't pay for the immunization. So my role is to vaccinate those children.
And what are we vaccinating for?
Vaccinating for all kinds of diseases, like measles, MMR, the flu, all the required immunizations that the state requires them to get.
Yeah, to go to school in particular.
Yes,
right?
to go to school.
Now, when you're on the subject of measles, you mentioned measles. Now, we were one of the countries that didn't have measles anymore. Is that correct? And now we've had a reemergence of measles in the country?
Yes, so this started in Texas, and I believe it's because a lot of those children haven't been vaccinated against it.
Coming across the border.
Yes.
Yeah. So let's talk about the flu.
Yes.
And we have an illustration here of vaccination rates. What kind of a year is it for flu? Is it a good year, a bad year? We have a preponderance of flu victims?
Yeah, so we might want to start with our graph on the emergency department visits for the flu for that question, if they want to put that one up.
Sure. Emergency department visits. And when we say emergency department, we're talking about urgent care, Leahy, or some of these
Yeah,
places,
so the
right?
thing is this is from the Mass Department of Public Health, and this is their data dashboard, which anyone can Google and get on. It's an interactive dashboard, and you can find all kinds of information on this. So if you see there in green, the green line there shows the current season. So the bottom part, I believe, is the data goes through January 3rd. So prior to that, we had the peak, so around in December. So as you can see, it's starting to go down for this current season. The 2024 to 2025 season, the peak was a little bit later than where we are now, which is in February. So it is a high season. Last year was also high, or high. It appears to be higher than this season, because if you look at the different peaks on this graph, they peak and then they start to go down. Sometimes you see a little uptick on some of them, but for the most part, there's a peak and then the emergency department visits start to go down. 2023 season to 2024, the year before last, was lower than this season, but also relatively high. And then you can see, but the peak was earlier in the season than this year. So there is a season for this, but the peaks kind of happen at different times.
Mm-hmm.
Now, these are all emergency department visits.
Yes, because that's the way that they are able to collect the data, because people can have flu at home, they can never get tested, and nobody knows they had the flu, or they may have had some other kind of respiratory illness. So they could have had something else that wasn't the flu, or they could have had the flu. So that's how they're able to kind of measure the season, is by the number of people that go to emergency departments.
Right. Now, how is it in comparison to, for instance, COVID-19? Is this a bigger year? Is COVID declining? Is this a bigger year in terms of infections?
I didn't bring the graphs for the COVID, but I did look at them. And so the COVID-19 is lower than the flu this year. Yeah. And same thing with RSV.
Yes.
RSV is a lot lower this year than it was last year. That may be due, I don't know why, but could be more people getting vaccinated for that.
And what are the symptoms? Do the symptoms differentiate between the three of those, RSV, flu, COVID-19? When in your experience, can you tell by what somebody says to you whether or not they have the flu?
So all respiratory illnesses have similar symptoms. But if you have a cold, your symptoms are going to be mild. If you have the flu, or you have, let's say, COVID, the symptoms are going to be more intense. So symptoms of all of them are like fever. You could have a fever, you could have a cough, you could have a headache. Some children, they have diarrhea. You could have sore throat, congestion. So it depends on the virus.
So is there a test for the regular flu? I know there's a COVID-19 test, but is
Yes, there is.
there is a test for the flu?
There is a test for the
Is it a
flu.
blood test or a sputum test? How exactly do you tell?
Usually it's, they do it through your nose.
Nasal,
Yeah,
sure.
nasal, yes.
And what is the difference between RSVP? No, that's responding. RSV. Do we know any different, if there are any differences between that in terms of well, obviously not from a symptom standpoint, but what is the difference? It's just a virus, just like the others, right?
Yes, it's a respiratory virus, but it's different.
Now, are there any flu-related deaths this year?
We also have a graph on that one, if they want
Yes,
to
we
bring that
do.
one up.
We do.
Yeah.
Well, I don't want to ask for the death graph, but let's
It's the last one.
the last graph.
It's the last one.
Okay, so
There we
yeah,
go,
here it
Ted.
is.
Thank you.
So, yeah, the bottom shows this season so far. So as you can see, we're 112 and 5 children, 107 adults, and this is in Massachusetts. So these are the numbers from previous years. So last year, 470 for the whole season.
Well, that was obviously a bad year.
Yes.
And children are more susceptible to, this is more dangerous for children?
Yes. So flu can be dangerous in children because it can lead to pneumonia, severe symptoms, and it could lead also to death. And also if they have chronic conditions such as
Any comorbidity?
yes,
Yeah.
it can make it worse, like diabetes or asthma, it can make it worse.
So last year was a really bad year. Okay, here's the basic question. Why does this strike in the winter instead of any of the rest of the times of year? I mean, this is the peak period, right? December and January are the peak period?
Yes, the peak period usually is December, January, and February for any respiratory illness.
Is that because of Christmas parties and New Year's parties? Because people are close together during those periods?
Probably.
Okay, well, what do we do for prevention?
So to prevent the flu or any respiratory illness, the best thing to do is get vaccinated. Practice great hand hygiene. Wear a mask if there's a lot of people. Anywhere there's a crowd, wear a mask. And if you're sick, stay home so you're not spreading it all over.
That's probably the best advice, right? Okay, so what do you do if you get it? What do you do if you think you have it?
So if you think you have flu, prioritize nutrition, hydration, and resting. And with the flu, it comes a fever. If you have a fever, you could maybe take any over-the-counter meds. Always consult with your doctor. And overall, it's good to rest and practice a healthy lifestyle.
How do they develop the vaccine? Is there a different strain every year? Is that why the vaccine doesn't work all the time? I guess it has what, a 50 or 60% effectiveness?
So we have a slide on that to
Yes.
the most prominent strains.
Okay,
Here
there we go.
So the yellow there shows the seasonal type A strain, and then we have 2 other strains. So that's the most common one. So Sandy, you want to?
So this is the strain that's circulating around right now is the H3N2, And this is the one that is known, is called the subclade K, which is a subtype of type A. So this is the one that you see in yellow. And but there's other strains floating around, which is the type A, which is H1N1, and also type B.
Right.
And then one other thing about this graph, just so people know, so this is surveillance testing from Mass Department of Public Health. So this is people who got tested for flu. So they went to the doctor, they went to their emergency room, and then their lab results get sent to Department of Public Health, who then is able to tell which strain it is.
Right.
So that's where this data is coming from. So if you're, we don't know those people who don't go to the doctor or the emergency room to get tested, what type of strain is out there for them.
But I would think that this is a pretty good sample size, right? If you got 10,000 cases, then this would pretty much indicate exactly what strain we're dealing with for the year.
Or the more sicker cases, I suppose, the people who end up going to the emergency department or the doctor, you know, and getting the test, it's showing basically in those people the H3N2 is more prevalent. We don't know for the people who are not getting tested, maybe, so.
Now, is pneumonia a bacteria versus a virus? Because I know I get the pneumonia vaccine, which seems to last for a couple of years, right? But the flu vaccine you should have every year, right? Is it bacterial?
It
pneumonia?
is bacterial.
It is. So it's different than viruses are nasty because they, what's the word when they change their
mutate.
composition? Mutate.
Yes.
Yeah, good. That's from science fiction too. Yeah. So I guess this is a difficult question, but why does pneumonia not mutate and flu does? Just because it's different bacteria versus viral.
That's
Yes.
probably what it is.
Okay, so what do we do going forward if somebody thinks that they have it? Can they come to the Board of Health or how do we?
If you think that you have it,
Yeah.
don't come to the Board of Health. Yeah, I mean, if you're sick, you should stay home.
Right.
And if you feel like you should call your doctor if you feel like you need treatment. So certainly people can call us, but yeah, we don't provide any type of treatment. We're all about prevention at the Board of Health.
Right.
So we want to prevent these things from happening. So we don't do any types of treatment.
Okay, how do you interact with the school department? That's primarily where you have, I used to say when we had children that it was like a petri dish, they were all collected together all in one room, so anybody who got a cold was bringing it home. Do you interact with the school department determining, what treatment should be done or what activities should take place?
So Sandy mentioned earlier the Vaccine for Children program, so we work very closely with the school department with that. So if they have children who need to be vaccinated to get into school, they will let Sandy know. She will reach out to them and arrange for them to come to the Board of Health to get their vaccines so that they can attend school. So that's one way we work very closely with the school department. If there was some type of outbreak in the schools, we would definitely be getting involved. We monitor all communicable diseases through the state. So whenever there's a lab test that somebody comes back positive for a communicable disease or a foodborne illness, we get that information. That's a big part of Sandy's job to kind of look at that. And then if we have some kind of outbreak situation, if it is at the schools, then we would work with the schools on what we can, and as well as the Mass Department of Public Health, on what we can do to contain it, prevent it from spreading.
Now, what else have you got going on? I know you have a blood pressure program that people can go up and be tested for blood pressure.
Yes, we do blood pressure down at the COA, the Housing Authority. I think it's at the COA twice a month. Am I right,
Yes,
Sandy?
twice a month.
Yeah.
Yes, and once a month at the Housing Authority.
Well, we only have a couple of minutes, so any other programs you have coming up that that the public should be aware of that can interact with the Board of Health?
Our big program is going to be the health fair. So we have that coming up in April. So we're working on that now. We have that at the Burlington High School. And it's been several years now. I think we're on the 5th or 6th year now as the annual health fair. So the number of exhibitors is increasing every year. I think last year we had close to 60 exhibitors come. It's a very informative day for all ages. There's raffles and giveaway items, as well as all kinds of information to keep people healthy. Leahy Health is our sponsor, and they'll be there with several tables as well. So that's a big endeavor that we're working on now. And of course, we also in April we have our household hazardous waste collection event. So those are the two big things coming up, and then we have our regular programs, things like the blood pressure. We also are doing a fall assessments now. So we have the public health nurse under the grant. If someone has a fear of falling or wants to find out information on how to prevent themselves from falling, they can come to the Board of Health. It's a one-on-one for an hour with that nurse, and it's based on the CDC STEADY program, and she goes through everything with them for an hour. We also have a Matter of Balance program, which is that Sandy runs, which is I think 8 sessions, Sandy.
8 sessions,
Yeah.
yes.
Now, one last question, kind of an off-the-wall question, because weight loss is a big thing, and I noticed there's constantly on Facebook and other of these social media sites this new patch, and what's the other injection? I forget the name of it.
The GLP-1s?
Yes. What do you hear about these things? Are they beneficial? Do they work? Can you lose weight?
I don't know if we hear anything other than what everybody else hears.
Okay.
We have no inside information.
All right, so you don't
on
have
that,
anybody
then-
dying of getting an injection of this stuff, huh? What is it called? It's
GLP-1, there's many of them.
There's many of them?
There's tirzepatide.
That's it,
There's
yeah.
also Mounjaro, Ozempic. There's many of them. It's like 5 different ones of them.
Well, none of my friends are telling me that they've gotten really thin, so I'm not sure what their effectiveness is. In any event, thank you, Sandy. Thank you very much,
Thank you.
Susan. Our guests have been Sandy Troiani and Susan Lumenello from the Board of Health. Thank you for joining us.